Hi, Hi, everyone. My name is Tatiana. I work with Utah Health Policy Project. Part of our group, what we do is called Take Care Utah, and that is basically our outreach team where we help people apply for both Medicaid as well as the Affordable Care Act, which is marketplace insurance. So I'm going to be talking about what we do and how we help people, and I will be helping explain this a little bit to everyone. And if anyone has any questions, I will totally help answer those at the end. We also have other people from Take Care Utah on this call. I know Rosario is here as well as Julie. So please just let us know if you have any questions. So, I don't know why. Oh, there we go. It took a second to work. So, like I said, we help with the application process of Medicaid and CHIP, which is basically like a Medicaid program for children, and the marketplace insurance as well. But we also help people as we explain their health coverage. We do a lot of health education in that sense. We also help people find doctors, and we address barriers to health coverage, meaning that it's really difficult for specific communities to get access to healthcare. So we try to make it easier for them. We help them understand the process a little bit better. And we also help people do recertifications and renewals because Medicaid requires you to do that every year. And you can also re-enroll in Marketplace every year. And so we help people do that all the time, year round. Our services are free, so we just try to help the community as much as we can. We're not in it for the paycheck or anything. We're definitely just here to help people out. We have a lot of partners and just community members who help us here. This is just a screenshot of a few of them. We love working with like the University of Utah, with the county, with health departments all over the state. We're just really here to help people in the community and reach out to other groups in the community. So we basically help through a process of screening clients. So finding out information about them, finding information about the people in their household, about how much money they make, how much money they make in taxes, because their dependents may not be living with them or their situation might be a little bit different. And we also have to help people understand that the legal residency process is a little bit different for everyone. You can apply to Marketplace if you have legal residence with a green card or a work visa, but you need to be a citizen or have residence for longer than 5 years to apply for Medicaid. Once we understand a person's background and we do the screening process, we can do the actual application with them. At Take Care Utah, we are able to do this online. We have the ability to use safe software and use DocuSign to submit, to fill out the application online, send it to the clients if we're doing an application virtually, have them sign it, and then they'll send it back to us. Or we can do the application on paper and do it in person. That helps for when people come into our office, or we have so many health access assisters who work at different sites all over the state. And so we'll do applications in person at that point, and we'll have them sign it there, and we'll just help them through that entire process in person. And then our last step is submitting the application. So since we're a third party, we submit the application to either the Marketplace or to DWS. These paper applications are usually going to DWS for Medicaid. And then our job as health access assisters is to follow up. We walk through the entire process with our clients. And so we're just helping them along and making sure that everything gets submitted to the state. So Medicaid itself, starting there's a lot of different programs. Like I said, there's CHIP, the Children's Health Insurance Program. That's for children between the ages of 0 and 18. And the family income guidelines for that are a little bit different than other Medicaid programs. Medicaid itself, there's traditional and non-traditional paths. So in the traditional one, there's usually like family or child Medicaid. Another really popular one is adult expansion. That has like in its name, it's been expanded. So you can actually go up to 138% of the federal poverty level rather than only 100%, like in other states where Medicaid hasn't been expanded. There's targeted adult Medicaid. The TAM program is actually a really big part of what we do at Utah Health Policy Project. We help a lot of people who are being released from prison or jail, sure that they have health coverage as well. And then if a person is like right on the edge, or maybe if they're not, if they just need the help of Medicaid, there's the spend down program, and that helps people have Medicaid coverage. But if their income is over that limit for Medicaid, they can spend down to the Medicaid limit and still get Medicaid coverage. They'll just have to pay the difference on that. And then there's ABD, Age, Blind, and Disabled Medicaid, and that is a program for people who have specific income levels due to Social Security or assets, who have specific needs due to disabilities, or if they're older than the age of 65 and they have Medicare and they need Medicaid as a secondary insurance. This is a program to help people and supplement them further there as well. So like I was talking about a little bit earlier, everyone qualifies for Medicaid a little bit differently. Basically, you must be a Utah resident since this is a state program. You must be a US citizen or legal resident. So a legal resident is someone who has legally been in Utah for more than 5 years. They have a green card of more than 5 years is usually what I recommend to my clients. And they must meet their basic income requirements based on household size. So we have a handy dandy little table of income requirements for people on this. So we're constantly checking their income. It does change every year. So 2023's income might be slightly different than 2022. So we're always checking this. And this is before taxes. So we're always looking at a person's tax household, something that they would report on their taxes for that year. Medicaid and CHIP, like I said, there's lots of different people who qualify for that. So just like the traditional family Medicaid, that is for children up to the 18 years old. It's for pregnant women, for people with disabilities, or adults over 65. Where adult expansion is a little bit different. It's usually for like single adults who are aged 19 to 64. And they have the option of having employer-sponsored insurance, but it just might be too expensive for them. So this is one of those big handy dandy tables that I was talking about how the income guidelines for every program are slightly different, that there's different levels of it just based on the federal poverty level and the people in the household, the Medicaid program, all of that. Emergency Medicaid is also an option through the state. This is for basically anyone who is having an emergency and doesn't have healthcare coverage. A big group of people that we see with this is people who are undocumented legal status, or they have mixed status. So someone whose kids may be legal residents, but the parents aren't. And this helps with retroactive coverage. That's something that's really nice that the state does, is they can help you with it with an emergency, or even if you're applying for Medicaid, they can help you with something over the last 3 months. But emergency Medicaid is not continuous coverage, so it will only help with one situation when it happens. And then if you have another situation in the future, another emergency, you will have to apply for emergency Medicaid again. And then, like I mentioned, there is retroactive coverage up to 3 months in the past as well. And that is also for any kind of program for Medicaid that they can help with. I kind of described what a spend down was already. So it's basically if your income exceeds the eligibility, Medicaid instead of denying you, they say that they have the option of helping you get that coverage as long as you spend down the difference. This is also not continuous because if you're on a spend down plan, you have to do that payment every month. On the months that you don't do that payment, you won't have that Medicaid coverage. TAM, like I mentioned as well, there are income restrictions. Each program's a little bit different, like I mentioned. So TAM, you have to have a super low income. This is usually something that our prison and jail teams do the first week that a person has been released from incarceration. So they're not having that super high income, just, well, not super high, but that high income over that limit for TAM. They're not having that yet. So it's a really time-based program, and the justice system is involved. There's a lot of people who are involved in drug or mental health court, and we help people get benefits based off of the needs that they have, especially upon release from incarceration. So once a person does the whole process, once they fill out the application, we submit it, we help them through any verifications that they need, any stipulations that DWS or the State Department needs us to help them with. Once those are all done and accepted and they've been approved for their plan, what we do is we help them select a plan. So we can help walk them through this process. We also work in accordance with the Utah Health Departments. They have people who work there called health program representatives. So we will work with the health department and the client so that they can select a plan. There's a bunch of different healthcare plans that are offered in Utah for Medicaid. After they select a plan, they receive their Medicaid card. We can help them pick their primary care provider. That is basically just finding a local provider that accepts their Medicaid plan. Then they schedule their wellness appointment, something like a yearly physical, they get their preventive care, and then basically they just do the cycle for a year. And then when their renewal comes up, we help them reapply and get that Medicaid coverage the next year. Selecting a plan, like I said, it's fairly straightforward. It's really easy. You just call the health department and there are the 4 plans there. So it's Steward Health, Healthy You, Molina, or Select Health Community Care. And it's pretty easy to pick a plan just right over the phone. I've had it take as little as like 5 minutes over the phone, and that's something that our clients usually really appreciate. There's another benefit for Medicaid clients. Online, there's a resource called My Case. That's something that us health access assisters have access to as well, since we're basically case managers for a lot of our clients. So we can go online and see what verifications they have, what verifications they've submitted already. If they need to do a renewal, we can do that with them online as well. There's a lot of really helpful benefits that we can use online as well. And so Medicaid itself, for every family, it's a little bit different. Like I said, Medicaid itself is free. There's no premiums or deductibles. There are copays, but they're really inexpensive. So they help the people who really need access to that coverage. CHIP is different because it is based on a slightly increased family income. So there's 2 different plans of CHIP, just depending on which plan the family chooses. It's either $30 or $75 per family. And that's something you only pay quarterly rather than monthly like other insurance programs. There is a deductible of $40 and up to $1,500 per family. And there are copays, but they just depend on your plan and your service and where you're going. So I'm not sure for everyone who is in this group, if you know all of your terms for insurance. It's definitely something I've had to learn with time. Basically, a quick run through are these terms. So premium is the amount that you pay for your health insurance every month. That's like kind of your subscription payment. Your deductible is the amount that you pay for your covered healthcare services before your insurance plan starts to pay. So that is like the amount that you pay fully up to that year if you need services. And then after that amount hits, your benefits start to kick in, and then you'll be getting decreased payments for any other health services in the future. Your copay is like a fixed amount for every service that you pay each year. And that is something that you pay only after you've hit your deductible. Co-insurance is the percentage of costs covered health service you have to pay. So rather than paying like a fixed $20 per service, you'll pay a fixed 20% per service. And that's something that's usually found in your coverage plan that your insurance company gives you. Your max out of pocket is like the maximum you're going to pay for the year. This is usually like the worst case scenario. So if you go to the hospital and you have a bill that racks up to be like $10,000, but your deductible is only like $1,500, you'll pay that first $1,500, and then after that your deductible will kick in. So after that $1,500, if it's like 50% for an emergency, you'll only pay what's ever left. So basically for the entire year, if your out of pocket max is $9,000, you're only paying that $9,000. If you have a bill for $10,000, for example, no matter what, you're only paying $9,000, and your insurance company is going to pay whatever else you have paid over that $9,000 limit. And then your primary care physician or provider, that is kind of the person who you always go to if you need any other service. So if you have like a sore throat or you're feeling a little stuffy throughout the year, you'll go to them first rather than go to like a specialist, because they can provide you prescriptions that you need and any other things that you need directly. If you do need more qualified service, you'll go to a specialist with a referral after that. But they usually coordinate your healthcare services first before anyone else. And this is something that usually helps you with your network a lot as well. You just want to go to your primary care provider first. Something else that I'm sure a lot of you students know already is that the ER, urgent care, and telehealth are kind of like different levels of service that you want to receive. So the urgent care is for urgent things that are maybe not so emergent. So like if you cut your hand and you need a few stitches, that's probably something that you'll go to emergency, like urgent care for. But if you like cut your arm and you're bleeding and you may have nicked an artery, that's something you probably want to go to the ER for. So it's basically just understanding how big your problem is, because just to keep costs low for you, it's definitely more affordable for you to go to the urgent care than it is to go to the ER. Telehealth is something that you can use as well. There's a lot of primary care physicians who use telehealth. There's a lot of urgent care centers that use it. So you don't even have to go to the urgent care itself if you're having a problem like a cough or a cold or something that won't be fixed by having a physician touch you, you can do that from the comfort of your own bed. I have done that before. Telehealth has saved me a lot of times. And it's something that we can use now more than ever just because we have the technology to do so. So, like I said, always use your primary care provider for continuous care, for your medical history, for preventive things and wellness checks. You can go to a specialist when you need a referral, and that's for anything that has like a really developed problem. So your orthopedics, your neurology, your anesthesiology, dermatology, anything that kind of ends in an ology, I'm sure there's a specialist for it. Urgent care, like I said, that's more for things that are onset and they're acute problems like headaches, flu, fever, stomach aches, those kind of everyday things that can be acute and you can definitely get care for. Those are often open for after hours care, so that helps a lot. Emergency rooms are always open too, though, but those are for more like life-threatening health conditions. Definitely things that are out of the ordinary that need to be solved right away as well. So like chest pain, abdominal pain, strokes, severe injuries, super big burns or trauma, stuff like that, definitely go to the ER. Community resources for people who don't have any kind of coverage. There's a lot of places that we are at that we find people who to get coverage there, but as well as this is like the kind of place that we would send people if they don't qualify for Medicaid or marketplace insurance. So they go to community health centers, to free clinics, and there's a lot of community resources like health fairs and wellness buses where they can get vaccinations, as well as just super quickly be seen by volunteer community health workers or people who work in the community for low cost services. Switching gears a little bit, so that was a lot more about Medicaid. as well as free programs. Going forward, we're now talking about the Affordable Care Act. Some of you may have heard about the Affordable Care Act, Marketplace, Obamacare, it's all the same thing. This is a affordable way for families who have a slightly higher income or even like super high, because everyone can get a plan on the Affordable Care Act as long as they qualify. This is a health reform that is super recent. It was passed in I think it was actually passed in 2012 and 2010, somewhere around there. And this is for people who needed more expanded healthcare that weren't getting it before then. So it expanded healthcare for people who had pre-existing conditions, who needed their essential health benefits met. There aren't any cap limits. Men and women weren't paying the same amount of premiums or like deductibles before. So now they are. And then this actually really helped people in the younger generations age range, because you can stay on your parents' health insurance plan until you're 26 years old now. It used to be 18. And I don't know about you, but when I was 18, I did not know what was going on with my life. And so being able to stay on my parents' insurance until I was 26 really has helped me out so much, because you're still learning how to be an adult at that point. You're still understanding what the value of money is and what the value of your health is. And so this is something that really helps you up until you're 26, when you can feel more responsible enough to pick your own plan for yourself. So a lot more people qualify for the Affordable Care Act than they do for Medicaid. So this is people who are US citizens, so they have a social security number, or as long as you have any kind of legal documentation, that can help as well. So this is for people who have green cards, and you don't even have to have a green card for 5 years. You just need to have a valid green card for the Affordable Care Act. There's certain visas that are accepted. So I think students and work visas can be accepted as long as those visas are valid. However, DACA DACA status people are not accepted. This is something that people are working on currently. We're hoping changes, but that is a status that is rejected for the Affordable Care Act. So this is 2022's table, and this is actually the exact same as 2023. But these are basically the income limits for household sizes, as well as different percentages of the federal poverty limit. So these first two columns, so the yellow and the orange, these are for people who are applying for Medicaid specifically. So 100% of the poverty level will get you accepted for traditional Medicaid, family Medicaid, child Medicaid, things like that. 138% will qualify you for adult expansion. And then going forward, after 138%, you would apply for the Affordable Care Act. So on the Affordable Care Act, we use a lot of different services for this. Our organization uses something called Health Sherpa a lot. It helps us understand subsidies that people can get based on their family's income. So if you have an income between 138% to 400% at the federal poverty level, you will not be paying the full amount of premiums for health plans. There's a bunch of different plans and a bunch of different subsidies to actually give you a reduced monthly premium, and even deductible. Sometimes these help with deductible plans, and it helps lower the cost of these plans so that healthcare can be more affordable for all people throughout the United States, and that they can access the amount of care that they need, regardless of their family's income. There's different levels of these subsidies, like I said, so that is all just based on your income. Another thing to look at on this chart is that CHIP, so up to the 200% of the federal poverty level. So up to that purple column, people can be eligible for CHIP. And so that is a Medicaid program that is slightly different because families' income can affect their children differently there as well as they apply for CHIP. So steps in the marketplace, it's actually really similar to filling out a Medicaid application. So you'll fill out an application online. We usually do this virtually, or we can have people sitting with us here, but we show them our computer screens as we're filling out applications for them. So we'll fill out the application. This includes their personal information, you know, like their demographics, their family's income, the people in their family, all that kind of stuff. Then after the application is submitted and we see if they're eligible for the Affordable Care Act, they'll select a category for it. So here they have catastrophic, bronze, silver, and gold. There's actually a new one this year for 2023 as well. It's called the platinum level. Most of the time we suggest that people choose a silver level plan. There's a lot more benefits that come with that. We found it to be super, it's on the more affordable side for people, but have good benefits and good plans with it. And there's also other programs that we can help people with find lower premiums if they choose a silver or higher level plan. And then there's a bunch of different plans itself to choose from. There's a bunch of private companies who have marketplace plans, most popular being the University of Utah Health Plans, Select Health. There's also Molina, Cigna, and Bridgespan, as well as Regents. We don't have that listed here, but Blue Cross Blue Shield, they are on the marketplace as well. So this is not completely accurate. So in 2023, due to the public health emergency, we actually have an extended open enrollment period, but usually the open enrollment period is from November 1st to December 15th. So it's a 45-day period where anyone all over the United States can apply for the Affordable Care Act. But outside of that period, they would need to qualify for a special enrollment period in order to apply for the Affordable Care Act. During this open enrollment period, though, we are going crazy just trying to help as many people as possible to find as many people who need insurance. This year, though, during 2023, it's a little bit special. We actually have an extra month added to that open enrollment period just due to the public health emergency due to COVID. So up until January 15th is when we have an open enrollment period this year. So that's in 3 days. So we're going a little bit crazy here at work, being super busy, trying to help as many people as we can. But like I mentioned, 45 days out of year, it's not the longest time, but that is when people are recommended to get their health insurance. Everyone has different life circumstances, though. Things change throughout the year. So like I said, you can qualify for a special enrollment period if you're still trying to apply for the Affordable Care Act any other time during the year, but you have to qualify for these with like a specific life event. Within 60 days, you have to apply for the Affordable Care Act when you have one of these life events. So something like getting married, having a baby, if you're released from incarceration, or your immigration or legal status has changed, or you're a member of a Native American or Indian tribe, that one, the 60 days is a little iffy. That's kind of hard to label within 60 days, but there's an open enrollment period for that as well. And then loss of insurance is always something that is available for a special enrollment period on the ACA. Something that the ACA does do is they want to know if you have insurance available through your work or employment. A lot of times if you do, they will suggest that you take that option unless it doesn't cover all the essential health benefits and the minimum value standards. But if you do lose insurance due to like divorce, death, aging out, or moving, anything like that, you will have a lot more options for a special enrollment period. So like I'll just briefly talk about this because this is starting to get into the nitty gritty of what health insurance actually is, but there are different metal categories, like I said. We often suggest people get silver metal categories for their plans just because you're paying 30% of the plan while the insurance pays 70%, so that's a much larger amount. It's a moderate monthly premium. You get more savings, you get more things included in your plan. And like I said, there's other benefits that you can find through our organization if you choose a silver plan or higher as well. And these plans are often a lot more affordable. They're the best kind of value for people who choose plans. But these other plans, most plans are good. It just depends on how much you use your health insurance. Silver plans are, like I said, it's kind of for people who use their plans a medium amount. If you are choosing a gold plan, that's probably for someone who needs to go to the doctor a little bit more. If you're choosing a bronze plan, that's probably for someone who understands that they'll go to the doctor a little bit less in the year. It just kind of depends on your situation and how much health coverage you think is necessary for you and your family. So just wrapping up, there is something called the public charge. So the public charge test looks for certain factors to decide if a person is likely to rely on government support in the future. And so people who are already eligible to enroll in Medicaid and the Affordable Care Act should not avoid enrollment because this is basically just saying that if you need health insurance in the future, that the government will be there for you. Public charge is just trying to understand how many people need insurance at a time. It does affect you because everyone needs coverage at some point in their life, especially for students. I know there's a few students watching right now. For young people and for students, a lot of times we think that we are indestructible, but that's not necessarily true. So if you don't have health coverage, it's super important to understand that there is a public charge for you to get health insurance. Because if there's an accident or an emergency and you're not covered because you thought you were indestructible and you find out you're actually not, it's a lot more affordable for you as well as for the state for you to have health coverage before something happens. So something that we do at Utah Health Policy Project is we help a lot of children, specifically Hispanic children. And I'll just briefly touch on this because I understand that most of the people in this presentation are not under the age of 18. But something that we do is we help children who are uninsured. Utah actually has a super high rate of children who are uninsured. We're number 43 out of 50, so super low on the list for having all of the children in our state enrolled. So that's something that we're trying to do better at, and that's what our organization helps with. So in conclusion, we can help you out if you're looking for Medicaid or the Affordable Care Act. We're just here to help people get coverage. That's our main focus. If you work with us as case managers, it's more likely that your case will be approved because we have been in the business. We've submitted our fair share of applications. The system is really difficult for a lot of people to see through. A lot of the smartest people in the world have told us that it's impossible to read through all the applications and the forms. So if you have case management, it's more likely that you'll get enrolled. It's more likely that you'll get the care that you need. Not to say that you can't do it yourself, but if we can make it easier for you, we really would want to. And so just getting to know you more as you come to talk to us. We'd love to talk to you about your experiences, why you need healthcare, what has led you to finding us, and how we can help you with that, because everyone faces different barriers, everyone gets help differently. And if you would like to learn more about healthcare, about insurance, about receiving the care you need, we'd love to talk to you more about it and learn more about your experiences and help you learn something new as well. So that's the end of my presentation for now. I know I've talked a lot about different programs, a lot of different things, but if you have any questions, my name's Tatiana. I'd love to talk to you about that more. Julie is one of our leads of the family team, of the Chipper team. So we're helping with families and kids, and specifically Hispanic families. And Luis also helps us, and he is the head of our Affordable Care Act team. So if you have any questions about open enrollment or finding a marketplace plan, we can help you with that. So that being said, that is the end of my presentation. If you need to find us, this is our office phone number or our website. You can schedule an appointment to meet with us online there, or you can just walk into our office. We have walk-in hours 9 to 5 Monday through Friday, and we're in West Valley. So I'll stop sharing my screen now, but thank you guys so much for listening.